Are you troubled by reflux? Would you like to know more about investigating this condition and the various treatment options? My name is Ahmed Hamouda. I'm a consultant upper GI surgeon, and in the next long format video, I will give you a presentation about this condition and hopefully give you some more information regarding. Thank you. Gastroesophageal reflux disease is a chronic condition which is caused by acid that's normally in the stomach going up through the valve at the lower end of the gullet and flushing up into the gullet. Now, this valve here is created by the strength of the muscle layer in the lower end of the esophagus, as well as the angle between the stomach and the gullet, as well as the arrangement of the lining of the stomach, and that creates a high pressure zone which naturally prevents the acid from going up into the gullet. It is a very common condition to have acid reflux, and it's considered significant if the symptoms are occurring on a weekly basis, once or twice a week. The typical two symptoms that people mostly get are heartburn, which is this burning sensation that you can have behind the breastbone after a meal or any triggers that may cause you reflux. And the second very common symptom is regurgitation, where there is a perception of a flow of fluid coming back up into the gullet or going to the back of the mouth, and sometimes coming up into the area of the teeth and your mouth. Mostly people will have reflux if, for example, they've had a previous sleeve gastrectomy. It's a very common reason to have reflux. If they've been smoking or if they carry a bit extra weight. If people develop a hiatus hernia where there is part of the stomach that has pushed up through the diaphragm into the lower part of the chest and sits next to the lungs and the heart where it shouldn't be. Pregnancy can increase the abdominal pressure. Eating a large meal late at night, especially if it's quite a rich meal with fried food. Beverages such as coffee or alcohol, especially if it's acidic such as wine, and stress can, of course, increase heartburn and reflux symptoms. There are certain medications that may cause or worsen the condition, such as non-steroidal anti-inflammatory drugs, which are commonly used for pain. I'm thinking of naproxen, ibuprofen, aspirin. To evaluate the condition, I would need to perform an endoscopy, and that is quite a diagnostic test. It is a test where a camera is passed through the mouth into the gullet and the stomach, and it will pick up conditions such as a hiatus hernia or inflammation. Another test that's really very useful is a pH monitor, and that is a test where a little probe is left in the gullet about 2 inches above the stomach, and over a period of 3 to 4 days it measures how much acid comes up into the gullet. Recently, this test can now be done wirelessly without needing a wire that comes through the gullet and through the nose to a tape recorder, and that is called a Bravo capsule wireless pH test. Other tests may be required, such as a barium, where dye is ingested and an X-ray is done, or a CT scan. I'd like to talk a bit more about a Bravo reflux testing system. This is a quick 5-minute procedure which is done with you coming off all your acid medications 2 weeks prior to the test. It is done very similar to a camera. Actually, it is done in combination with an endoscopy. It's performed under throat spray and sedation, where you're given a drug to make you drowsy. And the Bravo capsule, which you can see sitting there, very small little probe, is suctioned onto the wall of the gullet, approximately 2 inches above the stomach. It will then measure how much acid comes up into the stomach over a period of time and transmits this to a recorder that you carry with you for the next 3 to 4 days. The test period should ideally last for about 4 days. This is the way the Bravo capsule is inserted. The rubber bit is the placement device. It is locked into position through a pin that actually attaches to the lining of the sidewall of the gullet, and the probe sits there for a period of about 3 to 4 days before eventually falling off and going through the lower end of the bowel and is passed out spontaneously. Stop. These are images of the camera showing what a Hyde's hernia is. Basically, the camera is the black tube. It is looking back onto itself at the lower end of the gullet, and you can see there's a large pit here, which is basically formed by part of the stomach being pushed up into the chest through the diaphragm. This pit should not really be there, and you should not have this part of the stomach sitting above the diaphragm, which is essentially this circle here. What this can cause is inflammation of the lower end of the gullet. We classify it in 4 stages. There's grade A to grade D. The first stage, you can see that the inflammation is 1 or 2 streaks, which only occupy a very small part of the circumference. With grade B, you can get 3 or 4 streaks, which become longer. Grade C, you get part of the circumference, which becomes inflamed. And in grade D, the whole circumference of the gullet can show inflammation and evidence of acid reflux injury. To manage esophageal reflux, there are 3 stages. The first stage is to try manipulating your diet, as well as some lifestyle changes, such as raising your pillow or your bed height, trying to lose a bit of weight, and stop smoking. It is essential that you avoid any food which can result in you getting this heartburn sensation, and to not lie down for 3 to 4 hours after you've had something to eat. The second stage, we go on to medications, and most people will have heard of proton pump inhibitors. They're a group of medication which prevents the proton pump in the stomach from producing acid, and it's quite effective. But it's known that over a period of time, these medications can have long-term detrimental effects on your health, which can include things like osteoporosis, bone density decrease, and heart conditions, chronic kidney disease, and in some cases, early onset dementia. These are some of the side effects of the medication in the long term. And it's now we're becoming more aware of the seriousness of staying on this medication for a longer period of time. So what can we do if the medication doesn't work, if we need more and more doses, if we are worried about the side effects, or we're non-compliant to the medication? In other words, we don't really want to take it every day, or we forget for some reason. We can then go on to consider the third stage, which is to have a procedure, an operation to fix the Hyde's hernia and to prevent reflux from occurring. This is an operation that's been around for quite a period of time. It was described by Dr. Rudolf Nissen, who first performed this procedure in 1955. And essentially, it is trying to recreate the valve at the lower end of the gullet that we talked about previously by wrapping the stomach behind the gullet and back onto itself and stitching it in a place where it occupies 306 degrees circumference around the gullet. This is an operation or procedure that should be considered if you have had long-term reflux, which is not responsive to medication. There's been evidence that the inflammation caused by the reflux is quite severe, it's progressive, it's causing a stricture or an ulcer, and you are worried, or if you are worried about taking medication in the long term. This is how it's performed. So the stomach is pulled behind the gullet, and then it's wrapped around and stitched back onto itself, creating a 360-degree wrap around the lower end of the gullet. It's performed in 2 stages. We talked about this before. And in summary, what you need to take out of this presentation is that reflux disease is a common condition. It can lead to things such as Barrett's, which is a change of the lining of the gullet from one type to another, and this can in itself cause future problems, and therefore you need to be checked every 2 to 3 years with endoscopy if you have Barrett's. It can cause inflammation, it can cause a stricture or a narrowing as a result of the inflammation. If you would like to have a non-surgical treatment of this condition, then we talk about lifestyle and dietary change. We also talk about medication, and of course we have to consider, first of all, the side effects of the medication, the non-compliance issue, which is if you don't want to take it for a long period of time, and the cost over a long period of time. The last stage would be to consider surgery, which can be very effective in controlling your symptoms and improving your quality of life in the long term. We are talking about a 90% chance of cure of this condition following surgery in the long term, and this is measured over a period of 5 to 10 years. Thank you very much.